Good morning, everyone. This is our presentation, Older Adults and Substance Use Disorder, for Social Work 663, our oral presentation at Widener University. Maggie Sharp is doing the original slides 20 through 28. Caitlin Brook is doing the slide 12 through 19. And my name is Gwendolyn Bowers, and I'm doing the original 1 through 11 slides. Our client is Valerie. She's a 67-year-old Caucasian woman who identifies as heterosexual, Christian, and is married and has been estranged from her husband since 1988. They lost both of their sons in a highway fatality due to alcohol and drug issues in 1998. She presented with depression, anxiety, health issues, a history of alcohol abuse, not keeping her appointments, and stopping her medications on her own, which may have resulted in some legal issues in the past. She is currently nursing her mother at home, and her brother, he has had a stroke. Her mother is elderly, and her father is in ill health with his current wife in Cecil County. Her brother does not work. He is also on disability, and her dog died recently. Valerie reveals no history of substance abuse in the family and has been disabled for many years. The identifying information: Valerie is 67 years of age, female, Caucasian, heterosexual, of Irish descent, and identifies as Christian. She's married and has been estranged from her husband for many years. Her two sons are deceased. They died in the very same highway fatality. Valerie has a 9th grade education. She is in the low income status, and her house is deteriorating. She's been collecting disability for many years. She's unemployed, and she's a resident of Cecil County, Maryland. Some of her medical concerns and issues: Valerie has diabetes, and she recently lost 2 toes. She is on metformin for her diabetes. She presented with depression and anxiety and is taking 100 milligrams of Zoloft every day. She has trauma issues. She has heart and blood pressure, high blood pressure issues, which she takes medication for, and she has co-occurring disorders with her mental health and alcohol. Some legal involvement: Valerie was charged with a DWI in 1999, and in 2005 she was charged with a disturbing of peace. Valerie is presenting problems. She is presently living in her dilapidated family home with her mother, who is in very poor health, and her brother, who has had a stroke. She presented with depression and anxiety and is looking to see the provider for her medications. Valerie recently lost 2 toes due to her diabetes and lack of circulation. She lost both of her sons in a highway fatality in 1998. She depends on others or the medical taxi for transportation, which is a hardship for her. She is a caregiver for her mother and her brother and has few friends. And her father is older and ailing, and her dog recently died. Valerie does not attend church or the senior center. Valerie started with this agency in 2000 for depression and anxiety and has not been keeping her appointments for a long time. She is in the pre-contemplation stage of change. Her cases were closed many times for not complying with treatment with the provider, therapy, or even the mobile unit. She has transportation issues, which is her biggest barrier. She has never been forthcoming about her use of alcohol. Valerie lost both of her sons at the same time in a highway fatality, which involved alcohol and drugs in 1987. Valerie comes from an Irish background, has great stress in being the caregiver for her mother and her brother, as well as the trauma of losing both her sons at the same time. Her diagnosis: major depressive disorder, moderate. Um, this is from the DSM-5. Depressed most of the day, almost every day, indicated by your own subjective report or by the report of others. This mood might be characterized by sadness, emptiness, or hopelessness. Markedly diminished interest or pleasure in all or almost all activities most of the day, nearly every day. Significant weight loss when not dieting. Inability to sleep. Psychomotor agitation or retardation nearly every day. Fatigue or loss of energy nearly every day. Feelings of worthlessness or inappropriate guilt nearly every day. Diminished ability to think or concentrate nearly every day. Recurrent thoughts of death or suicide. Symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. The episode is not due to the effect of substance or to a substance or a medical condition. The occurrence is not better explained by schizoaffective disorder, schizophrenia, or any other psychotic disorder. There has never been a manic episode. Valerie also presented with generalized anxiety disorder, moderate, excessive anxiety and worry occurring more days than not for at least 6 months. The individual finds it difficult to control the worry. The anxiety and worry are associated with 3 or more of the following symptoms: restlessness, feeling keyed up or on edge, easily fatigued, difficulty concentrating, irritability, muscle tension, sleep disturbances. Valerie's substance use disorder is also moderate, and according to the DSM-5, in order for a person to be diagnosed with a disorder due to substance, they must display 2 of the following 11 symptoms within 12 months. Consuming more alcohol or other substance than originally planned, worrying about stopping or consistently failed efforts to control one's use, spending a large amount of time using drugs or alcohol. Using the substance results in failure to fulfill major role obligations such as school, work, or home. Craving the substance. Continuing the use of the substance despite health problems, which includes blackouts. Continuing to use the substance despite its having negative effects in relationships with others. Repeated use of the substance in a dangerous situation like driving a car. Giving up or reducing activities in a person's life because of the alcohol or drug use. Building up a tolerance to the alcohol or drug. Experience withdrawal symptoms after stopping using. And withdrawal symptoms typically include anxiety, irritability, fatigue, vomiting, or tremors. The special population in older adults that we're speaking of today is considered, in this article, baby boomers. Those who were born between 1946 and 1964, and those who used illicit drugs and or were heavy drinkers. In 1979, this population, they were between the ages of 15 and 33, and according to this article, in the year 2000, 2001, there were 1.7 million baby boomers with substance use disorder and it is predicted that in the year 2020 there will be 4.4 million. So the aging baby boomers will increase the demand for substance use treatment. And some of the prevalence of this will be, the outcomes will be depression, anxiety, diabetes, heart problems, alcohol misuse, trauma issues. The impact on this population will be poor nutrition, having to use medications, physical complications, loss of independence, and possibly institutionalization. The theories that Rogers suggested for this population is the medical model, adjustment theory, disengagement theory, activity theory, which is very popular in nursing homes today, Peck's theory of ego integration, or Peck's theory of ego integrity, aging well, and Kubler-Ross's theory of death and dying. Valerie's history and culture is she was born in a low socioeconomical family and lifestyle. They live in an old mill town in Cecil County, Maryland, after her grandparents relocated here from Mountain City, Tennessee in the 30s. Valerie was raised in the Methodist Church, which is located right down the road from her house, but she does not attend church regularly now. I thank you for listening to my part in this presentation, and I wish you all well. Thank you.